Dr. Amanda with StraightSmile Solutions, and today we're going to be talking about compliance contracts. And you may hear me mention these a lot on my blogs or my podcasts about the importance of a compliance contract. Now, keep in mind, compliance contracts need to be customized for your practice, what you're offering, your menu of services, your particular dental practice act in your state. So there is no one size fits all for a compliance contract out there, which is why I'm not just like giving these templates out that I have. I have some suggestions, and I would recommend, I'm going to take you through all the line items here. If you want a copy of one of my templates for compliance contracts, I'm glad to send it to you. I don't want them just getting all lost out in the world out there. There's a lot of why behind it, so I'm going to connect with each of you one-on-one if you want a copy, just to make sure it's being used for good and not bad, if that makes sense. So give me a buzz if you want a copy of it. info@straightsmilesolutions.com. StraightSmileSolutions.com. You can send us a message, we'll connect, and I'll give it to you. Anyways, I'm going to take you through some of the line items and the why briefly behind it. But again, there's no one size fits all. You need to customize. You need to talk to your own risk management company. You need to talk to your own attorney, and you need to read your own Dental Practice Act. So this is of kind of a aggressive compliance contracts. I don't necessarily recommend that you use the exact one. I think you need to tone it down a little bit, but I'm giving you the very right of center version of what I've seen out there, okay? So let's start first of all with about broken brackets. And if you're only doing aligners in your practice, then this really doesn't apply. But then again, I strongly recommend that everyone that does aligners also does brackets and wires, or at least has the system set up for that, because there's always going to be that one off that either doesn't want that or starts aligners and just doesn't like plastic and wants brackets. And that makes it very difficult in your practice if you're not offering them, because what happens then, right? You say, oh, sorry, they get really upset. So it's great to have an upgrade policy to go from aligners to brackets or vice versa. And build that into their treatment fee at the beginning. So they know at the beginning, hey, you paid for aligners. The cost to change from aligners to brackets is Y or X. Usually I charge, oh my goodness, indirect bonding fees are $310. Obviously, there's your time to remove the attachments, to re-impress, rescan, bond the brackets on, do the treatment plan, and take them off later. So at the very least, I would be charging, $600 to $800 for the upgrade, bare minimum $500. So that's one thing you want to talk about. Again, let's talk about broken bracket policies. You should have a standard policy. All the patients coming into your practice who are getting brackets and wires should know what the policy is. My general policy, to put it out there, might be different than yours. Usually I'll give 3, 4, 5 brackets for free. I might be pretty loosey-goosey on that. I also make it crystal clear that I warranty my brackets for 24 hours after placement. If something breaks within 24 hours of placement, you need to call me within 24 hours of placement, and I will warranty them. That means I will repair it at your convenience to the best of my ability. If it breaks after 24 hours, and that means they actually need to call within 24 hours, then that is something that you did. You ate something, you bumped into something. It could have been as innocuous as biting on a fork, and you loosened a bracket. And a lot of times brackets, you need to let patients know that brackets may present as loose after the trauma, whatever knocked them loose, actually happened. So you might have eaten something like bit on a bone or eaten something a little too crunchy with dinner on a taco, but you may not even fully have it break off for a few more days. So you might wake up in the morning and have it be off, but yet they're like, oh, it just came off in my sleep. No, that's not really how it works. But anyways, just explaining that. So be really transparent about how that works. Have that warranty, whether you want it to be 24, 48, 72 hours after brackets are placed, and make them crystal clear that if they give you a call within that period of time, no problem, we fix it. It doesn't count towards your broken brackets. That way they're not being mad. Listen, bonding a bracket is a complex biomechanical process. Sometimes something can go wrong. So it could be the tooth, the crystalline structure of the tooth, the bonding agent, there's lots of stuff. So let the patient know, they won't be mad. After that, you get X amount of broken brackets. What I would also make clear is that broken brackets or fixing them takes additional extra time. We do not do that at regular braces appointments. You need to give us a call in advance and schedule a longer appointment. If you come to an appointment with a broken bracket and you didn't check with us ahead of time to see if that is okay, then we will most likely not be able to repair it. Also, we do not fix brackets after 2 p.m., 3 p.m., or on weekends, unless you've worked it out with us in advance. If you have a broken bracket, you'll need to call and move it to an earlier appointment. That pretty much nips that problem in the bud. Using a let's see, like a program like gporthotracking.com, dentalmonitoring.com is great because they can check in weekly or bi-monthly, and you can actually see the broken brackets, which is great, so they're not showing up with surprises. Because after the first month or two, every broken bracket is another month in treatment. Okay, so we talked about broken brackets, we talked about upgrade policies. Good to have a termination policy in place. People move, things happen, someone's sick of treatment, they lose their jobs, they want to know how that works. It's nice to be upfront with it. Hey, this is how it's going to work. First visit is X. Obviously that's going to be the cost of records, the lab fee, services rendered, the treatment planning fee. So usually the first visit is going to be at least half to 2/3 of the whole price of treatment. After that, each additional month in treatment is Y. Obviously I like to, if I think it's going to be an 8-month treatment, I like to have the rest of it go over the 8 months. So if they choose to discontinue and it's early, then they may not have to pay for all the total balance, which means you may have to give a small refund. But you need to put that in writing how that's going to work. If you do not have a policy, then probably somebody's going to side with the patient if there's a complaint. All right, beyond that, what else do we have? Termination for non-payment, that's also kind of a bit of a gray area. In many states or many risk management policies say once you get started and you do anything irreversible to a tooth, like interproximal reduction or extractions, you need to finish the case even if they don't pay. So check with your own risk management provider and also with your own dental practice act. Same thing with non-compliance. You want to have a non-compliance process in the works where you give them 1, 2, 3 warnings, write down how that works. After the 3rd warning, we will we will terminate the case, and again you will be billed for services rendered or however that works. Some of these are early termination fees will be assessed. You can do it like that. I also have an early termination or debond contract that you can have them sign as well. So same thing with failure to schedule appointments or multiple missed appointments. That would all fall within that. Okay. Termination for non-compliance, we talked about that. Termination for poor oral hygiene. Termination for clinical mistrust, and you have a terms of service. All those are different line items as well. Now you need to talk about insurance. Of course, insurance generally for ortho insurance, it is not paid up front, it's paid over a period of time. So that's something you need to let your patients know, that if they terminate their insurance and they have ortho insurance, they may have to pay the remainder. So I've had lots of doctors that didn't understand that it doesn't work like it does in general dentistry. So patients might be like, yeah, I have insurance, and they verify it and they start the case and they start billing the case, and then the patient lets it go, and then the doctor doesn't get paid. And then they're like, well, you didn't tell me that. So that's why you need to have that in writing. Again, we have brackets, missed appointments, miscellaneous stuff. I mean, that's pretty much it. That's all about the compliance contract. Putting everything out on the front end, making sure they know what the upgrades fees are. If they want to go with fixed instead of removable, I would always have an additional fee. Keep in mind that anytime you do anything fixed, whether it be like a Mara or a Forceps, a Herbst, a fixed distalizer, a pendulum, anything like that, you're gonna have way more emergencies that are gonna come up in your practice. And sometimes these emergencies can be severe. I had to have a call at the ER one time at 1 a.m. on a weekend because I had to go in because my patient had something fixed and there was like a spring and it poked through his cheek because he was in a car accident. And I had the oral surgeon had no idea what to do, how to, take apart this appliance because I had to have like a little wrench or something. So there went my weekend because I had to go help, and I felt awful that I had put this in his mouth. But this is why I always start with the removable first. Removable is included. Fixed is an upgrade. Anytime you want anything fixed, when I could do removable, because you know what? I know stuff's gonna happen. And emergencies are bigger, breakage is an issue, patients complain more. So I fully believe that all patients can be compliant if they understand the why behind the compliance. And if they know that there's an additional fee for fixed or for an upgrade, they might just actually wear it. And if they don't, well then at least you're getting paid for the extra work. So that's pretty much it. And then as always, give a window of time for each treatment. Obviously, if I'm doing a braces treatment and I'm anticipating it's going to take 8 months, I might give some wiggle room and make it be 11 or 12 months. But after that 12 months, the case is now expired, barring any extraneous things. I mean, obviously you can have some flexibility of that. And if so, the patient disappears, they ghost you, they stop coming in and then they come back, which will happen a lot with ortho patients. That is now an additional fee to get started to reactivate the treatment. It's a completely new contract. So if you put that again in the contract, this is not an issue if patients ghost you after a certain amount of time. Obviously, you need to be trying to contact them and documenting all the phone calls, their certified letters, but after 1, 2, 3 times in a certified letter, the case is now done. So that's pretty much it. That's how compliance contracts work. If you have any questions, again, don't forget to visit StraightSmileSolutions.com and schedule a complimentary meeting. We're glad to talk to you about it. All right, have a great one. Thank you.